It's Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we have way more content coming out.
And you got to stay up to date with it.
It was good until you did that.
Okay. Sorry.
Hey guys, welcome back to another episode of the AltMed podcast. Andrew Dowling here, with me as always, my co-host Mitch Kurtz. And remember, if you like this podcast, and I know there's a few people out there that do, they told me, please remember to hit like and subscribe wherever you get your podcasts. Got a very special guest on today, founder, proprietor, one of the biggest pharmacists in the medicinal cannabis space here in Melbourne. From Terry White Chemmart in Hawthorn, it's Andrew Farmer. Andrew, welcome to the show.
Thank you very much for that fine introduction, and thank you for having me on the show.
No, that's all right. We've been hearing your name for many, quite a number of years actually now. So how did you get into the space? What sort of led you into dispensing medicinal cannabis at your pharmacy?
The minute it got legalized, it pricked my interest, and then I had a look at some of the overseas markets, Canada in particular, and just had to think about how it could be expanded in Australia. We started off like anyone else who goes into this, started off small, doing 1 or 2 scripts a week, and then it started being known that we were happy to dispense, happy to go through the initial rigmarole of SASBs and the trouble that they caused. And then I sort of tried to liaise with initially Althea, a couple of doctors, and just start getting the ball rolling. And then it's just the whole industry's got bigger and bigger and bigger. And at the same time, we have as well.
Yeah. And did you, just from early days, did you kind of get a sense that it was going to blow up just in terms of demand, or like, were you getting good feedback from patients when you sort of first started to dispense?
Oh, absolutely. You get, it's one of the areas, I think it's a last resort for a lot of people. They've gone through the opiate pain relief, or they've gone through the benzo sleep problem. They've gone through a lot of other things before they get there. And when they find success with it, they're so happy to tell you about it, which is somewhat unusual in general, that you don't get that many positive stories from just traditional Schedule 4 and Schedule 8 medicines.
Yeah. Is it also, though, is it a bit of a double-edged sword in the sense that because you're dealing with people who, as you say, it's for some medicine of last resort, they've tried everything, they've gone through so much frustration, heartache, pain over the journey and trying to really treat whatever their medical condition is, that are they a bit of I feel unkind saying it's a bit of a special breed of patient in the sense that you can expect to sometimes, hear about it if something's not working, or what's your kind of takeaway?
I think you've got a number of different segments in the market. If you just talk about the flower segment of the market, there are some very experienced users in that area. They will be very quick to tell you that the quality of the product that we're sending out is not what it should be. It's either too dry, it's too brittle, it might be slightly damp, so therefore it doesn't vaporize properly. So that's one segment of the market. Another segment of the market that we do a lot in is the Veterans Affairs. They've had a longer journey to get into their medicinal cannabis than certain other groups to get it subsidized, and they can be initially extremely grumpy, should we say, and critical of the process that they've had to endure to get their medication. Generally speaking, after a couple of months of going through a couple of cycles, they're very happy with the process and very happy with the results that they get from the medicinal cannabis. And then you've got the general cohort that they need nurturing along the way. Otherwise, they can become disillusioned with the whole process as well. Unless you've got someone who's prescribing and then someone dispensing it who understands titration, or balanced oil, CBD oil, THC oil. You need people that understand those things along the way, so that the best patient outcomes do happen for your clientele. And people do get grumpy when things aren't explained along the way, whether it's cost, whether it's this is the balanced oil, it's a starting point. They get disillusioned or grumpy if it's not clear and open communication along the way.
Yeah, no,
So
understood.
they're not necessarily a cohort that's difficult to deal with. They can just be a cohort that's had different experiences to get their medication.
Yeah, and it's different to just your standard, get a prescription for a PBS, pay maybe $20 or something for it.
Yeah.
It's always there. I think the thought of people out there being told, oh, we've got to get in touch with, the sponsor of the medicine that you've been prescribed. You've got to wait some time for it to get to our pharmacy. All of that just adds to the pain and really all part of the reason why we love talking to people in the industry and doing this podcast, because we're really trying to raise awareness around, a lot of issues, but access is still, I know it's improved since when you would have been doing it a few years ago, but it's still something that I think, that there's definitely room to continue improving.
Oh, there definitely is. And so part of the problem is the growth of the industry. And then, we've got new companies popping up all the time, and they've got a really good flower, but then they promote it, doctors prescribe it, and then they run out for 2 months. And that's another frustration along the way for customers. They get onto something that's ticking all their boxes, that's helping them get to sleep at night, and then the next month they call me up and say, oh, Andrew, can you dispense my next repeat? Well, sorry, I haven't got the same thing. I have to contact your doctor to see if we can substitute it for something in the same category, make sure he's happy, and then I'll get back to you, and then I'll supply it to you. And then that's another, with the expanding industry and the new players in the market and what it is, you're growing a plant, you can't fudge it. You got to, it's you've got to try and get your plant at, if it's a 30% THC plant, it's quite hard to do. So there are those sorts of hiccups along the way as well.
I feel like it's kind of a bit of the worst kept secret, but there are certain patients who are, let's say, less of a medical patient than others, and I guess you would get.
That's quite a wild allegation, Mitch.
Well, I think everyone knows. I mean, it's a substance that's been around since the beginning of time. There's plenty of people accessing it on the black market, let's say, who have also figured out that they can get it. There might actually be a genuine medical patient. They might not be as much of a genuine medical patient. Who knows? But I guess you'd get caught in that crossfire. As a pharmacist, you have a duty of care to patients, but at the same time, you're now possibly dealing with people who treat it as a consumer good to some degree. Yeah,
and we are trying to pay particular attention at the moment for what would be deemed as overuse. So in theory, if we're talking about the flower customer, which is predominantly where this section of the market sits, I think you've got definitely somewhere around 20% of that market, perhaps more, that would be deemed just recreational users and have got it on prescription, perhaps not through fully legitimate means.
Yeah.
They probably still utilize it as a medication though, and they're using it to get to sleep or whatever they do, but they've gone through it a different way. So that's part of what you're talking about, Mitch, and that's there are a cohort in there, but then there's a vast portion of the people getting flower that are legitimately using it for pain or for sleep or for PTSD or any of those things. So I hope that the last couple of years where the market has got a bit skewed towards the flower, and there has been, I don't know if they're taking the piss, so to speak, and like getting 4 canisters of 10 grams a week, which you clearly would struggle to vape in a week. perhaps there needs to be a bit more regulation around that, to make sure that the government and the powers that be feel it is a legitimate medication on our, within our health system.
There's an interesting thing I'd be very curious to get your perspective on. Sometimes, and this idea of patients returning medicine because of their perceived quality, let's say, of the medication, and we're hearing that some companies get returns that are totally related to aspects of the medication that are seemingly only recreational analyses, have nothing to do with the actual medical efficacy. Let's say they might say it's a bit dry, or it looks like XYZ, or I don't like the XYZ flavor. These kinds of things are flavor is maybe, or it burns your throat. Okay, genuine concern there, let's say. But we have heard of a lot of patients doing a bit more of the kind of, it's not up to the standard of, it's basically.
They need to be reminded that, you're not running some Seattle dispensary and you're a bud tender. Yeah. And, it's like, this is actually, from our purpose, a medicine, right?
Yeah. So we're quite stringent on those kind of complaints. Like, all the staff are trained initially to say, well, it is a plant extract. Whether you've got an oil or a flower, there are going to be definitely variations between batch to batch. Oils will have a different viscosity, a different color, a different taste. If they've changed the carrier oil, it all changes. What the most important thing for them to know is that everything is assayed at least 3 times. It gets cultivated, it gets assayed, it gets bottled, it gets assayed, it leaves the factory, it gets assayed. So if the label claim is that it has 21% THC and less than 1% CBD, that's what's in it, plus or minus 10%. And there's, that's our initial stance. And then if people push further, we'll say, well, if you're happy to send the product back to us, we will send it back to the sponsor company, and then they can assay it again and let you know whether there is an actual fault with the product, or whether it's absolutely fine to be using, and the label claim is what's actually in the product.
Yeah. So, no, and that's true. Like, you're so right. It just given how strictly regulated the product is, and the GMP requirements, this sort of stuff. I'm actually sort of reflecting on, as you said that, just perhaps respectfully, how little patients would understand about what actually happens behind the scenes to bring a product to market, and all of the different requirements around quality control and compliance testing that go into it.
And that's not to take away from a lot of patients who do know a lot about the plant itself, because there are a lot who know a lot more than say a lot of people in the medical community about the actual plant itself. But when you're talking about bringing a pharmaceutical good to market, there's quite a bit there to unpack in terms of making sure that it complies with the relevant standards. So no, it is interesting to get your perspective on that. I am curious to know what products you do see the most of coming through the pharmacy dispensary. Do I call it, or
dispensary?
Yeah.
I think we can all look at the national data. The biggest flower on the market is the T25 Topaz.
We don't talk about products on the.
Don't talk about products.
Sorry, I meant product types. Apologies.
Product types.
Yeah, product types. We keep it compliant.
There's this product type that starts with T and rhymes with as. No, anyway.
Okay. We can skip that. So we can talk about the fact that the flower market has dramatically increased over the last 24 months. That's gone from 0 to, not being able to keep up with demand.
Yeah.
Clearly, you look at Cannabis and some of the other articles that have been recently published, this CBD only market would seem to be stagnant or reducing. And then the alternative formats like capsules, gummies, wafers seem to be sort of ho-hum. And then the balanced oils and the other oils have seemed to remaining fairly steady or slightly increasing in their volumes. But the flower market's where the growth's been completely for the last 24 months.
And have you noticed the
aroma in the pharmacy?
The aroma. So we've got 6 big safes full of product. The safes that contain the flower, there's a definite aroma around those safes all day long.
Yeah. Well, I mean I'm sort of wondering whether or not if it wafts out onto the street, whether you have prospective customers just coming in who are a bit curious to find out what they can get their hands on.
It all happens at the back of the dispensary, so it's all. You first open the first thing in the morning when you open the safes in the morning, you get a very strong smell coming out of the safes.
Yeah, no, I can imagine. Actually, just on that, we've seen, I guess, the regulator, the TGA, has cracked down a little bit on advertising, mainly against sponsors for alleged contraventions, but I have seen as well a few pharmacies that have, received a please explain letter. Have you sort of had any, not any regulatory issues, but have you, in terms of the activities in the pharmacy, are you only dispensing to patients, or do you sometimes have people in the general public that, they're just interested, they want to learn more, and how have you kind of been able to handle that? And I'm sorry, I should say, I ask from the perspective that I know that effectively a lot of people in this industry feel, like they can't talk about it or anything because the rules can be quite onerous. Yeah.
Yeah. I do feel that because of all those laws and because it is so onerous, that is part of the reason why customers are finding it hard to get their medicinal cannabis, because it can't be advertised anywhere, it can't be promoted in any way, and people just struggle to know where it is, other than platforms like Reddit or other platforms that openly talk about it, but it's not me promoting it, it's our customers promoting it. As far as the regulatory bodies, I think the last survey that the Victorian Pharmacy Authority did and the other governing bodies in Australia, they've now included on their scope of practice questions, do you dispense medicinal cannabis? So I have a feeling that within the next 12 months, as I tick the box that I dispense medicinal cannabis, that I may have a visit, and then they will go through the safes, or they will go through the DD records or those sorts of things, and just to see that everything's compliant. And part of the problem of remaining compliant is because there are so many new products that come onto the market, and I've got to continually get my supplier, the software supplier for the DD book, to be continually updating. Otherwise, I fall behind. I can't enter, invoices, and everything doesn't balance, whatever. So there's a constant struggle to remain compliant and up to date and make sure that it's all ticking the boxes of all the regulatory bodies. And it's hard for me. I'm sure it's hard for suppliers, manufacturers, everyone within the industry, because it's, as you say, it's really highly regulated.
Yeah, absolutely. And navigating potentially random audits from Vic Department of Health, you have the Victorian Pharmacy Authority, the TGA might want to have a look. I don't know if you've got any, veterinary. We are hearing there's a few pharmacies around Australia that I think have sort of started to dabble in veterinary medicinal cannabis. So there's another regulator, the APVMA, just for good measure, to throw in the mix there. So it really is, quite a strict environment to be operating in.
Yeah, definitely.
Is that probably the hardest part about what it takes to be a pharmacist in the medical cannabis industry, what you just said, or is there anything else that you find I'd actually really like to know probably the toughest thing that you guys face versus the best part of being a dispenser of this particular good.
Probably the toughest piece is the educating all of the staff, educating them in all the new products that are coming out, making sure that the knowledge they have is accurate and true to the consumer. Because as you say, some of the consumers are really educated in this product, and so we need to train the staff so that they can accurately talk about a new flower that's come out. Is it a sativa or is it indica? Is it a balanced flower? What are the terpenes? They need to be educated in that area. So that's keeping them up to date and making sure that devices are getting updated all the time. Like we've got a new something new that we had to get in the other day is a device to use to inhale. So that's the toughest thing for the staff in general. The toughest thing for me as the owner is staying up to date regulatory and keeping the DD book up to date. And the easiest thing and the most obvious thing is the positive experiences that the customers have is the most enjoyable thing out of it. Whether it's a veteran or whether it's just someone that comes in because they've had knee pain for 6 months, and then they've got to their titration point and their knee pain is like much better. They're back off opiates and then walking around and living a normal life. They're the happy stories, or the stories where people can actually get to sleep at night and have a great night's sleep. And then some of them are so skeptical when they go on it. This CBD oil thing, it's I don't know, I can't see how it's going to work for me. The doctor only says I need to take 0.2 mils at night, and they take 0.2 or 0.4 and they're really happy. They're the good. Yeah. That's the great part.
And it's I'm thinking of the area you're in Hawthorn. You really are kind of spanning all ages and a very diverse group. You've got families. It's a lot of schools in that area. Some retirees. So I'm guessing your clientele at the pharmacy would be pretty diverse.
Well, the clientele of the pharmacy is diverse, and because we're servicing some national clinics and shipping the medicinal cannabis out every day, that makes it even more diverse. Like Hawthorn, you would say, is a medium to high socioeconomic area, but there are definitely consumers that we have that are not from an area like that at all, and they probably place a lot more value on the product than potentially some of the other customers within the Hawthorn area. Yeah. The funny thing is, though, when you're a pharmacy and you have competition within the pharmacy and prescription prices may vary, I think because consumers value this product so much, we rarely have any price complaints. It's more about making sure that the service is quick and efficient and the product has gone out to the consumer. It's not about, well, is this going to cost me 155 or 150? That's rarely a query from the consumer.
Yeah, well, I think most people are now, at least the regular users, are probably quite familiar with the pricing structure. I think, a lot of the people get weeded out early, those who can and can't afford it, because it is really quite a high cost item, as I'd imagine. I mean, you're the pharmacist. You tell me, like, well, what do you get regularly that's as frequently as you might get medical cannabis that's more expensive than that?
Nothing.
Yeah, exactly. So, I think people are pretty aware of the price. And there would be a lot of people, I imagine, who are quite price conscious, though, especially the ones that possibly don't live around Hawthorn, let's say.
Yeah. Oh, well, I think the market's somewhat stabilized. If there are still some pharmacies out there that have a different pricing structure to us, and I think that's unfair on the consumer. So your 10-gram tub of flour really should be somewhere around the $150, $160 mark. Anything more than that's unfair on the consumer. And look, we do it so it's just a flat dispensing fee. So if you get multiple tubs, then the price comes down even further. Right. To try and, it's basically it costs the same to dispense and do all the regulatory things for every script. So it's just a dispensing fee. It's not a markup, it's not anything else. And that makes it fair for all the consumers, whether you buy one type of flower or one oil or 3 oils and 3 flowers. It's just to try and make it as fair as possible for the consumer. Because I agree, it is a high cost item when it is something you take on a regular basis.
Do you think that when you're saying 150 to 160, obviously when you're talking about a flower, that is there any potential that that's a bit too simplistic in terms of you would see a lot of different quality flowers come through there, I imagine, in terms of what's available on the market. Some should be far cheaper than that. Some might be slightly more expensive depending on the actual flower itself.
It's all theoretically supposed to be pharmaceutical grade product.
Mm-hmm.
So you would think that it really shouldn't vary too much in its quality. I know it does, and that can cause some issues. I think most flowers, for 10 grams of flour, sit in that price range. There are obviously some ones that are slightly higher, and there are some ones that are definitely lower. The ones that are in a lower price point, they do have a concession card holder scheme, those sorts of things, to make it more financially ascertainable for that consumer. Whether that product is of an inferior grade, I would not be the best person to answer that, but it may be. I'm not sure.
I'm not suggesting it is. I'm just saying, like any goods, basically on the planet, different qualities require, different inputs necessarily.
Yeah.
But yeah, no, I take your point. I mean, there's plenty of, from the feedback, there's plenty of fantastic options in the price point that you're talking about. So for sure, it's achievable within that range.
And equally, I've definitely also heard feedback about products that are, maybe 50 or 60 below the numbers we were throwing out before, and the quality is considerably inferior. So it really is a bit of a spectrum, pardon the pun. But well, Andrew, we know you're a busy man, and very, very kind of you to step out of your meeting to speak with us today. We'll say you're free to go, but we just really appreciate getting the lowdown from one of the more knowledgeable pharmacists I was going to say in Melbourne, but probably Australia.
I think that you've now got at least sort of 3 or 4 pharmacies in each state that are doing considerable volumes and are knowledgeable. And I think that number's only going to increase over time, given, we've had an exponential growth over the last 3 years, and it does not seem to be slowing down at all. It seems just up and up and up. Yeah,
agree. And the more, the barriers that come down, it's you're just going to see access improve more and more, which is a good thing.
Bit of a gateway drug.
Couldn't resist, Mitch. I saw that look in your eye. I knew you were going there. Andrew, thank you so much for your time. We'll until next time, take care.
Thank you very much for inviting me on.
No
Pleasure.
worries. Cheers,
Andrew.
Bye.
Andrew Dowling here, Mitch Kurtz here. Thanks for joining us for another episode of the AltMed podcast.
And if you like what we're doing, please like and subscribe. We have way more content coming out, and it's all fantastic.
Please.
Please, man.